You see the slides? Slides. Okay. All right. Thought we would do some quick team member updates, really quick. And then we would jump into what I really want to accomplish is to look at what we've accomplished in the last 2 years with this grant and really focus on what do we want to accomplish in this last year and start to get some traction toward that, because as you know, this grant ends in August of 2023. So that's less than a year out. And we also want to talk a little bit about what do we want to be after the grant is done, or do we want to be? So I think I'll go ahead and start with Trish. If there's anything, sorry, Trish is probably trying to also get other things done.
No, I'm here. I don't really understand what question I'm answering, though. I mean,
just tell us if there's anything you would like us to know about what's going on at the school, what's going on in the community from your perspective.
we're so happy that we actually have a counselor this year. We've been able to find one, so that's great. And we're having a good school start and good enrollment, happy kids and families.
Okay.
So, a good start.
Thank you. Lindsay.
Hi, everyone. My name is Lindsay, and I coordinate the Community Prevention and Wellness Initiative in the Port Townsend School District. And that's the grant that funds the Empowered Teens Coalitions, which are in all of the school districts in Jefferson County. And I'm based in Port Townsend, so a lot of my updates, I might not belabor at this meeting, but I guess one that I think would be notable is in the upcoming weeks, I'll be working with a group of students from the University of Washington Master in Public Health Community-Oriented Public Health Practice Program to do a community development project around overdose prevention policy and kind of capacity building around that. And I'm really grateful to you, Lori and Anya, for being open to meeting with me about that, and looking forward to talking to you tomorrow. Yeah, great to see you all. Thank you so much for having me here.
Thank you. Good to have you here as well. Ocean.
Hey, for those who don't know me, I'm Ocean. I'm the harm reduction coordinator at Public Health here, coordinator syringe services as well. In terms of updates, got some good collaboration stuff. Excited to be working with David and Anya on getting fentanyl test strips out. We now have safer smoking supplies that we've started distributing, and we were able to get some kits of clean syringes and other injection supplies for people who inject drugs down to Believe in Recovery for the with their mobile unit there. So they should have those if folks need them. They can be referred there. We're happy to restock them as they need. So I think that's probably good for me for the moment.
Lots of good stuff going on. Sheriff Noel.
Not a whole lot to report here, just things going as normal. I hesitate to say it, but the election's over, so that's a big relief. Just excited to continue doing this kind of work and seeing where we can take this kind of stuff.
I'm really happy you're at this table.
Me too.
Denise.
Hi, I'm Denise Banker, Community Health Division Director at Jefferson County Public Health. I'm happy to see everybody too and hear everybody's voices, and I'm glad we got everything straightened out for the meeting. Sorry if I played any role in having too many invitations on people's calendars. So at any rate, over here, some things that I'm kind of excited about is we received Foundational Public Health Services Life Course funding, and we are looking into hiring a harm reduction coordinator. So we don't know exactly what that's going to look like explicitly at this point, but it's in conversation, and its requests have been made. And so we will be keeping the group updated on that.
Thank you, Denise.
Yep, absolutely.
Lori Tinker.
Well, hi, sorry for my confusion too. I'm Lori Tinker, confused Lori Tinker. I am the hospital Jefferson Healthcare's representative to the EMS Council. And I guess apparently the president of that council for one more year after our last meeting. So I don't really have too much new or different to say beyond that.
Mhm. Thank you. Dr. Carlbaum.
Sure. David Carlbaum, Medical Program Director for East Jefferson County EMS. So I supervise the care of patients before the hospital. Big news, Port Ludlow had a cardiac arrest save of someone who used opioids and was pulseless, 19-year-old postpartum mom. And then continue to partner with Anya and trying to think about the right people to get the fentanyl test supplies out to. We're trying to decide with Tammy Ridgway if that should go in the leave behind Narcan kits or not, and doing some brainstorming. So Ocean, thanks for dropping $1,000 on a bunch of supplies. We really appreciate it. And then otherwise, EMS is just dealing with the challenges of hospital capacity. So St. Michael's primarily in Silverdale has been pretty overwhelmed. So last Friday, ambulances were waiting maybe up to 6 hours is what I've been told. That hospital appears to be sort of melting down, and then that has ripple effects into our local communities. Our local ED is really busy too, and just trying to ameliorate some of that friction that naturally arises when people are under stress between the ED and the EMS folks, and just reminding everyone we're all on the same page and all trying to do the right thing. So for that, yeah. Can I say something on behalf of Anya since she's not here?
Please do.
I just am so damn proud of her for passing out over 300 Narcan kits in 6 months. That's amazing, and I think might be a state record. And so I think it's just super impressive. And we've seen those kits used on multiple occasions by EMS where they arrive to find someone who's already received Narcan. So it's great.
That's what we want to do. We want to get it in the hands of anybody. Yeah.
Awesome. Love it.
I wanted to give you folks a quick update just on how the reporting structure goes now. The Behavioral Health Consortium grant from HRSA is held by Jefferson County Public Health, and I have been contracted to carry forward the consortium work through the end of this grant. And so I'm not working as CHIP anything, although the Behavioral Health Consortium is an outgrowth of the CHIP work. I'm only working on the consortium work and looking forward to getting a lot of stuff done here in this last year. Are there any questions on that before I hop forward?
I'm glad to hear that. I thought that a contract had been put out on you for leaving. Now I see you're contracted, so.
That might have happened as well. They just haven't caught up with me yet. I wanted to talk a little bit about what this grant was really quickly or is and what we're focused on, and then zero in quite quickly on what we're doing in South County. The grant itself, it was for 3 years, $1 million over 3 years. And with it, our goal was to do work in prevention, treatment, and recovery that improved access for our community residents to those services. So you can see we've got a whole realm of great players at the table. We knew that specifically we wanted to work with folks in South County because a lot of times it's hard to get them integrated well in what we have going on. And it's a critical piece of how we want our services to be accessed throughout the county. So these are all of the specific activities that the grant had required or does require of us to do in each of those areas. I would say that we have made great progress on most of them. If you look at an overview of the projects that we proposed that we would get done and that in the execution of those projects would meet all of the items that you see back here on this list, large list of activities that we needed to do. We had one of them, one of those goals was to extend harm reduction program services into South County. And I think that we have made some good progress. I'm sure that this isn't everything, but I wanted to give kudos to the fact, first of all, we're all still meeting. And I know that we are missing some key players today. I'm going to work hard to get them back to the table. Sometimes it's just scheduling issues, and sometimes it might be just because we've had a little bit of a transition going on, and we want to strengthen that tie between us all again. We've had the drug take back from Jefferson County Public Health and the Empowered Teen Coalition. That has gone well for a few years now. Thanks to Denise for starting it, and Lindsay and Holly for taking it forward in all of the different parts of the county. We have mobile harm reduction. Believe in Recovery is doing some of that, and I haven't even been able to connect with folks enough to know how that's going down there. So that's one piece of update I'll be interested in getting. There's engagement from the REAL team, and I'd like to hear more about how that's going or where we can improve the connection there. Just having Sheriff Knoll at this table and hearing the conversation and sharing with us what's going on, I think has been really useful over the last couple of years. We developed that yellow resource card, which if anybody needs more, we're happy to get you connected to those. And then as Dr. Carlbaum was saying, Onion has done some excellent work around the naloxone education and distribution sort of goals that we had for the county. Some of the things, one of the things that we have talked about doing at this table is a vending machine, and it has the potential to be put in at the Brennan Community Center. I haven't talked with Chief Manley recently, so I don't know if that's still a fresh hydrated connection or not. I do know that I visited the community center in Brennan before August. I think it was maybe at the end of July. And I didn't have the sense that the person there who runs the community center knew much at all about the potential of that machine being put there. And so I think that there is an opportunity just for some more communication, make sure that we've got everybody coordinated and on board, and making sure that we understand the things that they are concerned about as we look at going forward with that project. Jim Novelli has sent me the name of a company that I can call to start moving toward ordering a machine. I feel like we've got some things to do before we actually order. On the other hand, because we know that this grant ends in August and it's going to take some time to get a machine here, to get it hooked up, to get the technology going. There's a lot to talk about there, I think, before we actually place the order. And then there might be opportunities to do other things. And I think that if we have funding dollars, which I believe we're going to, I would like to find something else in South County that we can invest in here before the end of this grant that does help us with that improving access to behavioral health services. You can see that in the budget, I've put a $25,000 amount for that South County vending machine. So that is where I'm at on the budgeting front right now. I think it should cover that. There's going to be a technology aspect to it. There's going to be a buying supplies. There will need to be insurance. There's installing it. I don't know how complicated that's going to be. So I think there'll be plenty of opportunities to spend through that budget if we go that direction. One of the biggest things that I wanted to do at this meeting, and I do wish we had more folks from South County, but I can reach out to them individually, is I would like to get feedback about what we've been doing and what you would like to do in the South County area on the topic of behavioral health and harm reduction and improving the access to our services. So I've put a link, and I'm going to go there myself. Let me put it in the chat as well. Now this, you'll see there's a lot of information already in here. And I'm just seeing that there are some other comments in the chat, so give me a moment. Ollie, thank you for that link. Yes, do that survey. Somebody put the survey link in there. Great take back on October 29th. All right. Thank you everybody for putting stuff in the chat. Sorry, now I've got it open. Okay, So I am showing you a Padlet, which I put the link to so that you can go to it yourself. What you see is feedback that we've gathered from other people about the Behavioral Health Consortium. And then I've added a column that's specifically about South County harm reduction feedback that I would like for folks to go ahead and put anything that you think of. I will tell you that whatever you put into this, it's anonymous. I can't tell who puts in what. If you want to make it even more complicated, you could just put it under any one of these columns, because these are basically the same questions just under South County. So some of the feedback that I've gotten are things like, how could we improve access to wound care and that sort of thing in the South County area without somebody having to drive all the way up to the Port Townsend area or down to Mason. So I want you to be really creative when you think about what you would put in here in terms of what to improve, goals that you would like to see us move toward. And then lastly, I'm interested in knowing what this group wants post-grant. And I know that we don't have so much representation from South County here, but of the people who are here, how do you want to be engaged with South County going forward on the topic of behavioral health and harm reduction? So I'm going to be quiet for a little bit. I'm going to let people just read what's here if they want, just to get them their appetites whetted, and then go ahead and put your own comments into the Padlet.
And Lori, can I ask a clarifying question? Do you want us to click on the add comment under each one of those boxes, or click on the plus sign at the bottom of the column?
I think you can add comment or click the plus sign. Either way, it's helpful if you add it under the question so I know what it refers to. But if you don't, that's okay. I'll figure it out.
Got it. Thanks.
Lori, I had a question.
Go ahead.
Like in the second column, it says valuable / working. Then you get down, like the third one down says so much collaboration. Is that something you wrote or someone else wrote that?
I think somebody else wrote that.
Okay, got it.
The only thing that I've written is genuinely the things at the top, and every once in a while you'll see where I wanted to, like I noted that somebody over here somewhere said that they wanted more for EMS, more support supplementing 911 resources. And I wondered what would that look like in South County?
Okay, thanks.
Lori, I'm not seeing how I add a comment. What am I supposed to hit to?
So
add?
if you, are you in the actual website page? I'm going to stop sharing my screen so that you're not confused. Are you looking at the?
Well, now I'm looking at myself. It's not a pretty sight.
Okay, if you go in the chat and click on the link that's there, it will take you to an actual page where when you click to add a comment and start typing, it will take it into that particular box.
Now I think I'm in the right place.
Sorry about that. I bet I was confusing.
No,
folks.
I've been in the wrong place all over today here.
I can see people are still typing, so I'm going to give it a few more minutes. I see somebody wants another grant with more money. Okay. Everybody had a chance to put in what they wanted to? Thumbs up, thumbs down? Okay. I would like to talk a little bit about do we know anything about how the mobile effort, that mobile harm reduction that Gabby has going on, do we know anything about where that's set up and how that's working in South County? Sheriff, I don't know if you would know that. I think the same question I'd like to pose about the realty. Sheriff Knoll and then Dr. Carlbaum.
Well, I know a little bit about Gabby's setup. I went down there and visited one day, but I don't know all the exact details, but I think it's open every day, at least Monday through Friday. And it spends half the day at the Quilcene Fire Station, then the other half, it's driven down to Brennan. And then it stays at Quilcene right now. So Dr. Carlbaum, I don't know.
Yeah, that's correct. I think it might be Monday through Thursday or Monday through Friday. I'm not sure, but yeah, I think morning time is in like 2 or 3 hours in Quilcene. I think last update I heard from Gabby directly, they had one client there and one potential client. And then afternoons are in Brennan, and I think they have also one client there, and I'm not sure about potential clients. So still, I think getting people comfortable with its existence. And I think they write prescriptions. I'm not sure if they write prescriptions or if they recommend someone who can write a prescription for like buprenorphine or Suboxone. I don't think they dispense it, but I think they're able to assess people.
And I know that the gentleman that's manning it right now, James Weberly, he used to work in our jail and had left. And he was a real good fine for Gabby to have, and he knows a lot of the clientele. And he's, not that we have bad people here, but he's one of the good guys. It's a good person to have, and he's the one that works in it every day. So that was a big score for her to get him, I think.
Okay, so it's underway and it sounds like they're making some initial contact. And I'll need to reach back to Gabby to see if there's anything we can do to support that or otherwise get her in connection with more people. More people is always better. How about the real team? Is there much going on in South County with the real team? Are you aware, Sheriff Noel? No?
Yeah, I don't know.
Okay.
I know that, well, and yeah, I don't have a bunch of detailed examples right now, but I know that our navigator and the real team have been working closely together. So, and it seems like there's a lot of things where they collaborate on, but how much of that is South County, I'm not sure.
Okay.
And Lori, I could add, I know we've had several, a handful of situations where the South County Fire Departments, either Brennan or Quilcene, have asked the navigator to come help, and that's been very helpful. Some really excellent de-escalation on 2 cases where I think the person probably would have needed some chemical restraint, but the sheriff's navigator was able to de-escalate them and convince them to be taken to the hospital to be evaluated.
It's good to hear that there is some integration happening there. That's another thing that I want to make sure we see how we can support as fully as possible. As I'm looking at some of the feedback around what we'd like to think about supporting going forward or explore if we can. One is this question around pharmacy delivery. And it seems like this is a question maybe that has come up before. Dr. Karlbaum, is there any creative thing that you're aware of where we get pharmacies to deliver so that people aren't driving back and forth?
Yeah, I have no idea. But I was just wondering if there could be a pharmacy day as a
Pharmacy day run?
Yeah, as a sometimes embarrassed user of Amazon, I do try to use the Amazon day where, instead of a package coming every single day, you get like a bigger box once a week. And so I was just wondering if there's a way, if there's someone who's making that journey, if it would obviously require a little bit of logistics, i.e. the patient would probably have to say it's okay for this other human to pick up my stuff. And then there'd have to be some sort of bin at pharmacies, and you have to choose which pharmacy and then choose who's going to be the delivery driver, if that's, Ocean or Lori on her off time, or, or me or whatever, or someone from the pharmacy, if we were to somehow pay them a little bit for that effort, and then have a safe and secure place for people to pick it up, and what to do if they don't come to pick it up. Right, the devil's clearly in the details of the logistics, but it just seems like over and over we keep hearing about transportation challenges, and even though the transportation district has added or is trying to add additional buses, it just seems like that's a big barrier for people to spend an entire day just to get a prescription.
So if we had the transportation and the infrastructure process set up, it's something that we could do at least until the end of this grant. We'd like it to be a longer solution than that, but it might be a place to start.
And I don't know, as an outsider, that I'll become unanonymous. That was my idea. I don't know as an outsider of the community if there's a need for that or not. I guess it would be important to do a needs assessment of the community and say, before we invest a lot of time and energy, is this really helpful for lots of people, or is it just one person?
And it is interesting. You could use that pharmacy run for more than just Suboxone, and yeah, you could make it just a pharmacy run in general for folks. I don't know if that would be useful or not, but
that's what I was envisioning. Like, it's time for my blood pressure medicine to be refilled, and I don't have any transportation because I'm a cute 90-year-old elder who lives in a house by themselves in Brennan, and tend my garden, and I don't drive, sort of thing.
I think it's important to recognize it's just in past experience in helping Jefferson Healthcare open up a satellite pharmacy in Port Ludlow. There are, I mean, I hate to be a wet blanket, but going into looking at this, you need to go into it with the eyes wide open, that there are substantial hoops to jump through to be able to transport medicines like that. And I mean, it gets really sticky. And then just while I was listening to speak, Dr. Carlbaum, it was like, well, you know, maybe the hospital could have a 1-day pharmacy day down there, but the hospital's only one pharmacy. I mean, you have people who have scripts at multiple pharmacies around and sort of consolidating those and getting them for delivery to the right people. Boy, that it is not insurmountable, but that is a big whopping thing, almost as big as what I suggested about a wound care and IV infusion too. But it's sort of reorienting, you know, what are the needs of the South County that could maybe be coupled together in approaching it like that. I mean, we might as well do some big, audacious, big fat thing. Right?
And Lori, I love that. And I think it would be totally okay if it was not every pharmacy, but if it was like, if you want to use this service, you have to use one pharmacy. And if the hospital had the infrastructure and a clinic that's building that's there, that would make perfect sense too, as a destination for the delivery. Like, you know, you have to be able to make it to this building in Quilcene. And then if you had infusion at the same time, then you know, if you had a pharmacist travel there or whatever, I don't know what you need for infusions other than gloves and needles and nurses. That could be a really interesting idea. And I wonder if this group could somehow support with data and maybe some funding for the Jefferson Healthcare.
I'm responding to just very subjective feelings, you know, so the number of times that we did wound care on an IV drug user who was, the discharge became very problematic because of follow-up. And not only follow-up for the wound care, but follow-up for the need for, you know, a couple of weeks of IV antibiotics. Who was lost to follow-up because of that. Some of that has been mitigated with, I'm completely blanking on that, relatively new antibiotic that's just a one-time shot. But nonetheless, so, you know, I'm just responding because I was usually involved when there was a problem. So it seemed to me, you know, it seems to me from my perspective is that it's a significant problem because I was always involved in it. It may be something that comes up very infrequently. And so who knows, but developing, and this is where you, Lori Fleming, would be so good and helpful to us, is developing some guidelines for getting that kind of feedback from the South County folks as to what they perceive as their overriding need and the connectivity of what would do the most good in these communities.
And I think we need to look at we need to pragmatically look at the fact that this grant goes until August of 2023. And the things that we are talking about, at least in this most recent piece, are things that would take a lot of people working together to do something that we haven't done before. And that might be something that we would get done by May or June. And then we've got 2-3 more months before the grant is done. And then how is it carried forward? So I think it's a great idea. And if there's work to be done that would not get lost post-August, then that's a good place to invest our money. And if it would get lost, if it would sort of fritter out as soon as the grant was gone, then is there something else more productive that we can invest the money in now that we would be able to use that money to the end of the grant and it would have accomplished something positive. One of the things that I see on here, and Chief McCurran, it's good to see you. Thank you for coming on.
Sorry about that.
No, no worries. Remembering that our grant has prevention and recovery pieces to it, and that things that happen at community centers, I think, could be construed as supportive of prevention or supportive of recovery communities. One of the things I note in here is that the Brennan Community Center needs support, renovation, upgrades, et cetera. So I know that the funding can't be used for construction sorts of things, but is there anything that we can make a good story, a good case for that would allow us to put some money into the Brennan Community Center that would support prevention or recovery, community sustenance, that would allow us to, with good stewardship in mind, put some funds toward that would help the Brennan Community Center. And I'm not locking out the Quilcene Community Center. I just know even less about that. So I'll stop talking and see if anybody has feedback to that idea.
You know, is the Brennan Community Center, is that a county building?
I think that it's a county thing and everyone's just kind of washed their hands of wanting to do any upgrades, and Polly may know more. I mean, I could call Alicia Simmons in here. She would know a whole lot about it, but it's really a shame.
Yeah,
I can fill in.
Thank you, Holly. Please do.
And Alicia was at, and Lindsay were actually both at the meeting that I'm going to reference here. We just met, when was that? 3 weeks ago. The county does own the building. However, it's staffed and maintained by OLICAP. There was, this meeting had a lot of discussion over ownership and funding for like the structural repairs that need to happen, as well as maintenance for lawn and things like that. Greg Brotherton was there and was able to answer a lot of those funding questions. And I believe an advisory board was established at that meeting to begin to craft questions to bring to both OLICAP and the county in terms of, the roof. There's funds earmarked for a new roof and new siding. When is that going to happen, kind of a thing, to answer a lot of those questions.
Thank you, Holly. I'm so glad you have.
And can I chime in as well?
Please do.
Because I was at that meeting with Holly, and I actually think that they are going to meet next Tuesday evening. Unless that's changed, and then Jeremy is the manager of the community center, and he's facilitating those conversations as they create this advisory committee. So that might be an interesting meeting to attend next Tuesday.
My calendar says Tuesday at 6:30.
6:30. Is it a Zoom meeting?
It was in person, I believe.
In person?
I'm looking. I think it's in person. I don't think there's a Zoom link.
Do you think that, so who would be the best person for me to, I don't want to just show up and annoy people. Who would be?
I would reach out. Do you have Jeremy Simmons' email address? If not, send it to Alicia and ask her to forward it to him.
Okay. Simmons.
I think I had a conflict that day, but
okay. Maybe I can get down there and go to that meeting. Chief McCurry should, but do you know anything about it from the Quilcene perspective?
I do. As a matter of fact, I was going to jump in and wait for Holly to finish up. There was a meeting yesterday that was actually canceled. We had a seismic meeting just ahead of their supposed 5 o'clock meeting to discuss that very topic. And apparently the manager down there is Bob Rosen, and they're looking for a replacement for Bob. I would suggest probably reaching out to OLICAP is who I would reach out to, because OLICAP is huge down here. They definitely need to do some things. And I know that group that you're referring to, when I left, because they asked me to lock the doors, I felt bad because there was about 30 people waiting to meet and the meeting got canceled and a lot of folks weren't notified. So I can tell you that it didn't go over real well yesterday. So there's a little bit of distension amongst that group to do something. So yeah, definitely time to reach out to Oli, probably to those folks. I know that I don't know that Bob's ready to retire, I think, and that's what the plan is. So there's some definitely changes between the two communities. However, we do meet the first Thursday, and I told Holly about this meeting with the first Thursday at 6:30, and we rotate between the Quilcene Center and the Brennan Center. And it's actually the Lions puts it on, and it's just really a community outreach for about an hour. And then the second hour is just for folks to mingle and ask questions of everybody. But it's really pretty, they're really 6:30 to 7:30. You only get 2 minutes to talk. You're on a timer. And it's pretty stringent with that. But funny is some meetings we have 30 or 40 people, and other meetings we only end up with just a handful. So it's really up and down, but it's very well attended, and I think they really got a pulse on what's happening.
And so it's 6:30 to 7:30, first Thursday of the month. And where is this next first Thursday? Quilcy?
We didn't make a change. I believe it's in Quilcy.
Well, okay.
I think you've only had one in Brennan. Have you had any in Brennan yet or not?
Yeah, and Tricia, I know I did not attend the Brendan one. I had a deputy chief that attended that one, so I don't know what the plan is for movement, so.
I think, well, never mind. So first Thursday at
7:30,
First Thursday at 6:30, 6:30 to 8:30.
8:30.
Yep. And the first hour is just to meet and greet with folks. And it's pretty well attended. It's definitely community-based.
Yeah, I've been to it a couple times and
You have.
try to regularly go. And it to me, I think it's a really good thing. And someone like Lori or any of us here moving our ideas forward, it's a perfect place for that. So, yeah.
Of course, I'll qualify. I don't have an idea yet. It just seems like it would be a ripe place to do it. And so I am open to seeds that the rest of you can give me to go try to nurture.
Yeah.
Toward
Well,
that.
the way it works is everyone sits in a big circle, and then you go around the circle and you have like a minute to talk about what you do or what you're interested in. And so everybody hears that, and then people can ask questions the second time around. And so you get an idea what people's priorities are and things like that, what's available. I think it's a good thing.
Well, I'm gonna.
And just to say too, I don't know if this matters or not, but I happened to be at a political forum in Brennan a month or so ago, and the topic came up for the commissioner that was from Greg. There were some people that weren't happy with the way things were going at the community center there. So, but it sounds like the county's behind that to a certain degree anyway. And so now might be a good time to get involved in that part too.
So, and I see that Gabby's been able to join us, and I want to give her a chance just to tell us anything you would like us to know about the mobile harm reduction effort that's going on. And then we'll circle back. I know we're heading up here on 2:00.
I am so sorry I'm late.
No worries.
But I made it, so here I am. I think overall our mobile unit's been doing well. I have been able to work with the fire department in Quilcene to have some covered parking for the winter. That was one of our main concerns. So still trying to figure out how we're going to get from Quilcene to Brennan and back when the roads get real bad. I've heard it's bad. I've not been out there in the winter time, so I guess we'll see when we get there. I did work with Ocean to get some harm reduction supplies put on our mobile unit, which was awesome. So we have those available for people if they need them. And we've got some naloxone available still for people if they need that. I know that the rules just changed around behavioral health agencies being able to access naloxone from Department of Health. So I'm not sure what that's going to look like for us moving forward, but we'll figure it out when we get there.
Thank you, and I'm glad you got here. Okay, so what I'm taking away from this meeting are some things that are sort of further out are the wound care and the pharmacy piece, both very worthy causes. Don't know if we could put something together quickly enough and sustain it once we put it together, but it's definitely a need there that we should be keeping at the top of our minds, whether we're at this table or any other table where we might have solutions that we could apply to that. I'm hearing that there might be some opportunity around the community centers that we could put some funding towards supporting prevention or recovery environments. But that is going to take a little bit of digging, and I'll see if I can get to the Tuesday night meeting and then that first Thursday meeting to hear the conversation in person, so I might know a little more. I welcome any of you as you learn more or hear things, please stay in connection with me. I'd really like to make sure at the end of the day with this grant that we've done something tangible outside of this table and how we brought each other together to collaborate. I'd like to make sure that we do something tangible in South County with the money that we have, that we've been given the responsibility to steward. Any thoughts, last thoughts before we let everybody go?
Sorry, on the pharmacy piece, we have been talking with a pharmacy called Genoa that is like a mail order pharmacy that will deliver your medication straight to your house or post office box or wherever that somebody can sign for it. So we are in the works of trying to get that. Otherwise, my street outreach team for the people that we've been able to get on Suboxone or Vivitrol in South County, we're able to make sure that they can do their appointment via telehealth in our clinic, and then we're able to get them to the pharmacy to pick up their medication.
Oh, that's great.
That is great. That's really
Yeah.
good. Thank you, Gabby. Okay, Sheriff Knoll, I think you had a comment.
Yeah, just real quick, and I think maybe it's for Ocean, the South County, like talking about the vending machine, are those supplies available from the health department, just in general? I mean, can someone walk into the health department and get that stuff?
When you say that stuff, are you talking about like safer injection supplies, naloxone? Like,
Yeah, all the things that would be present in a vending machine.
yeah, I'm not sure what the plan for the vending machine was. My understanding was it was primarily naloxone, but absolutely anybody can come into public health and get naloxone. We also do have our harm reduction services, which includes safer smoking supplies, safer injecting supplies, and we have particular hours that's open. My hope, like Denise said, is that we'll get additional staffing and we can expand our hours and our reach into South County. I'd really like to send somebody to South County. But yeah, people can come get that here. And maybe,
I guess, yeah, go ahead, sorry.
Oh no, go ahead.
I was just curious if the vending machine would be like an extension of the health department.
I don't know what the thought for it was. Anybody else?
I think it started out with naloxone and then started turning into lots of other things that can be put in.
Well, so initially, DBH and I went to a meeting with some folks across the state regarding all of this, and then I continued in those meetings, and then also continued into a vending machine specific meeting that's national. And so yeah, there were lots of ideas about all kinds of things that could be in that vending machine should we be able to get one. And then there was the question of who would keep that vending machine full. And there was the question of who would sort of protect in some level that vending machine and where it would be placed. And then we sort of worked out a thing with, I think, it feels like Chief Manley, that it was going to be placed in Britain or
That's how I remember it too.
And then DBH's grant money fell through. So they couldn't fund it, and now we're sort of back in the area where should we be able to hire a harm reduction coordinator, then we will be putting that back up in the air, to discuss what this looks like, how we get it, what is in it, how people get access to it. Because a lot of it was predicated on like QR codes or someone handing someone a code so they could put it in, because you always have to put in a little bit of information in order to get what you're trying to get out of the vending machine out of it. So it's not just a walk up and pull on it and you get something, or push the buttons and you get something. So yeah, all that will be back up in the air, Joe, and to be discussed and determined.
And of course, the timing on that is interesting too. Should we think about going ahead and getting the machine on the idea that the harm reduction person will get hired so that we get at least that piece done as soon as we can? Or does it need to wait until we get the person on so the person has a chance to sort of be an integral part of the planning process to bring it in? Either way, it's, are we going to spend grant money on that or aren't we? And can we get our ducks in a row to do it sooner rather than later? Other thoughts before I let you all go? Thank you for dealing with all of the scheduling conflicts. Any last thoughts?
Lori, I put a link to what a small naloxone vending machine that's up and running in Austin, Texas looks like from Twitter.
Thank
But
you.
I agree with Sheriff Knoll that it could be a like a Japanese vending machine and have both the harm reduction things you expect and the harm reduction things that blow your mind a little bit. So it could be everything from COVID testing to condoms to fentanyl test strips to safe smoking supplies to you know, a filter straw if you're going camping up the river or whatever. So I guess send your dream harm reduction things to Lori probably.
One of the things mentioned was socks, I remember. I thought,
Yeah.
Yeah.
Socks and clean undies.
Big deal. Yeah. Okay, well, maybe next time we'll have a Padlet and I'll have everybody put in their desired harm reduction product that we would put in the vending machine. Thank you so much, everybody, for your time today, your energy and good ideas, and I'll look forward to seeing you next month, if not before.
Thank you,
everyone.
Lori.
Thanks, Lori.
Thanks.
Thanks, everyone.